Have you ever noticed how, like, just a tiny change to a nose can make a huge difference in a person's face?
It's incredible, right?
Yeah. So today we're going to be like diving deep, deep, deep into the world of rhinoplasty. And we're using Berkeley Square Medical's before and after page. Have you seen this?
Oh, yeah, it's a fascinating
It's
page.
really interesting, right?
Yeah.
Like, we all know people get nose jobs, but this is like,
This is like the inside scoop.
it is. It's like we're like little flies on the wall, like
Yes, yes.
eavesdropping on these consultations. So,
Because you get to see what patients are actually asking for,
right. Exactly.
which is really cool. It's like we don't usually get that.
We don't, so that's what we're looking at. It's like, what are people actually asking for when they go in for these consultations? So, big takeaways. When you were looking at it, what were people hoping to achieve?
Well, I mean, the biggest thing is that everybody's really looking for balance, you know?
Right.
They feel like their nose is either too big for their face or too crooked or just kind of like not really working with the rest of their features.
Yeah.
You see phrases like too large and disproportionate or crooked for her face.
Oh, I bet.
One patient even said her nose was too sharp and unbalanced for her features.
Too sharp. Ooh, I feel like that would make me so self-conscious if somebody said that about like my nose. But I think it's interesting that it's not always about size.
Right.
It's about like how it works with the rest of your face, which kind of makes sense.
It's all about the harmony
It is about the harmony, yeah.
of the face.
Yeah. And speaking of harmony, you mentioned that like one of the most common adjustments is tip refinement. So
Yeah.
what is that? Break it down for us.
So tip refinement is essentially where they go in and they're going to reshape the tip of the nose to either be smaller, more delicate, maybe a little more defined.
Okay.
You know, so you're really just sculpting that very end of the nose.
So like if before is like a bold statement nose, after is like a subtle, elegant nose, is that?
Exactly, exactly.
Okay, I like it.
And a lot of the before photos, it's funny because you look at them and it's like the nose is kind of like stealing the show a little bit,
Yeah.
you know? And I think that's what people are trying to balance out.
They are. That makes total sense. Okay, so we've got tip refinement. What about straightening? Is that a thing?
Oh, yeah, profile straightening is huge.
I bet, because if your nose is crooked, that's like your whole profile.
Your whole profile's a little bit off,
Yeah.
and this is often combined with fixing a deviated septum.
Oh.
So it's both aesthetic and functional, which is great.
That's amazing. Get 2 for 1. What other tweaks are we seeing?
Projection reduction is a big one.
Okay, projection reduction.
So that's all about adjusting how far the nose projects from the face.
Oh, so like how much it sticks out?
Yes, exactly.
Got it. Okay.
And that can actually make the nose look shorter
Really?
or even soften features, which some people find more flattering.
So interesting. Like, it's amazing how it seems like such a subtle thing.
Yeah.
But it changes your whole face.
It's all about the proportions.
It's all about the proportions. Okay.
And then, of course, you have things like columella and tip angle correction.
Okay, now you're just using words I don't even know.
So the columella, picture this.
Okay.
It's that little strip of skin that separates your nostrils.
Oh, like the little bridge?
Like a mini bridge.
Okay.
Yes, exactly.
Like the part that always gets sunburned on me
And
first?
that's the one.
Yeah.
And surgeons can actually adjust the length of that or the angle that it makes with your upper lip.
Wow.
There's
Yeah.
actually a really interesting example on the website, an 18-year-old who had this done. And it's very subtle, but it really just makes her nose look so much more balanced
Oh, interesting.
with her features.
It's like these surgeons are artists.
They are.
Yeah.
They really are.
They're artists with cartilage and bone. It's amazing.
Yeah.
And speaking of these patients, I was looking at the age range. It's not just like teenagers, which I kind of thought it would be.
You would think, right?
Like I was like surprised to see people in their 40s.
Oh, yeah, absolutely. They've got a 46-year-old on there.
Wow.
Yeah, it really makes you think like these insecurities that people have, they really do follow people throughout their lives.
That's so true.
Yeah. I mean, you would think by the time you're 40, you're like, over it.
You're right. Like you've got bigger fish to fry.
Exactly.
Okay, so we've got tip refinement, we've got straightening. Are there any other trends in terms of like the actual adjustments that they're making?
Oh, those are definitely the most popular. And it's funny because when you look at a lot of the after pictures, like there is this kind of trend towards a very specific look,
Yeah.
which is like this very delicate, slightly upturned,
Like a little button nose.
almost.
Okay.
It's very subtle,
Uh.
but it's there. And it makes you wonder, you know, these procedures, while they are intended to create balance and harmony, are they actually pushing us towards like a more homogeneous standard of beauty,
Yeah.
which is interesting to think about.
It's like instead of celebrating like all the different types of noses,
Yeah.
it's like, oh no, we all have to strive for the same one,
Exactly.
which is so interesting.
It's like airbrushing, but on a surgical level,
Mm.
which, I don't know, it's interesting.
It's very interesting, and it makes you think like, what are we really trying to achieve here?
Right,
Like,
exactly.
is it really about feeling good about yourself, or is it just about like
Or fitting into this box.
fitting in? Okay, so you mentioned non-surgical rhinoplasty
Oh, yeah.
earlier, and I was like, what?
Yeah.
What is that?
So non-surgical rhinoplasty is actually where they're using dermal fillers
Okay,
to reshape the nose, but it's temporary.
hold on. So instead of going under the knife, you're getting
You're getting fillers
fillers in your nose
in your nose.
to like plump it up in certain areas.
Yeah, to smooth it out, to maybe like lift the tip a little bit, that kind of thing. So it's
Yeah.
become very popular
I-
because it's much less downtime, obviously.
Yeah, instant gratification.
Exactly.
But is it safe?
That's the question.
I mean, I guess with anything there are risks, but do they talk about that on the before and after page?
They don't really get into risks too much.
Okay.
They really emphasize the experience of their surgeons, which is obviously very important.
Oh, for sure.
And they talk about aftercare,
Of course.
but they don't really get into like potential complications or anything like that.
Right, which I feel like is kind of important.
It is important because even though it might seem like a small tweak, it's still
surgery.
surgery. There are risks involved.
Exactly, and it's not just physical risks. It's like psychological.
Huge.
Right. Like, are you going to be happy with the result?
Exactly. Like, what are your expectations going in?
Yeah.
And will it match up with reality? Because that can be a slippery slope.
It's true. It's like, what are you actually hoping to change by changing your nose?
That's a great question.
So we've talked about like the motivations and we've talked about the techniques. We've talked about like the ethical dilemma of it all.
Yeah, ethics. Yeah.
For someone who's listening who's like, never even really thought about rhinoplasty before.
Yeah.
What is like the big takeaway from all of this? Like, what does this tell us about ourselves?
I think it's that we are, as a culture, kind of obsessed with beauty.
Always have been.